Welcome back to the channel. Today we're exploring a crucial question in the treatment of aggressive B-cell lymphoma. Is the CAR-T therapy tisagenlecleucel, also known as Tisacel or Kymriah, more effective than standard salvage chemotherapy and autologous stem cell transplantation or ASCT for improving progression-free survival? Let's dive into the findings from the BELINDA trial. Aggressive B-cell lymphoma poses a significant challenge when frontline chemotherapy fails. Standard treatment often involves salvage chemotherapy followed by ASCT, but it's curative in only a subset of patients. This limited success rate has prompted the need for new approaches to improve outcomes for these patients. One such approach is CAR-T therapy, which has shown promise in various hematologic malignancies. In the Phase 3 BELINDA trial, researchers compared the efficacy of tisagenlecleucel, a CAR-T therapy, with standard salvage chemotherapy and ASCT in patients with primary refractory or early relapsed large B-cell lymphoma. The trial aimed to determine whether tisagenlecleucel could offer a better progression-free survival rate compared to the existing standard of care. This study included a total of 322 patients, making it one of the largest trials of its kind. The 322 patients in the BELINDA trial were randomized to receive either tisagenlecleucel with optional bridging therapy or standard treatment. Most patients in the CAR-T group received bridging therapy, which helps manage disease while waiting for CAR-T cell manufacturing. Nearly all patients in the ASCT group underwent 2 cycles of salvage chemotherapy before proceeding to stem cell transplantation. The primary endpoint of the BELINDA trial was median event-free survival. Results showed no significant difference between the two groups, with a median event-free survival of 3 months in both. The hazard ratio was 1.07, indicating similar outcomes for patients treated with tisagenlecleucel and those who received standard treatment. This finding was unexpected given the high hopes for CAR-T therapy. While tisagenlecleucel did not outperform standard therapy in terms of progression-free survival, it did lead to a significant rate of cytokine release syndrome, or CRS. CRS occurred in 61.3% of patients treated with tisagenlecleucel, with severe CRS in 5.2%. This side effect is a known risk of CAR-T therapy and requires careful management to ensure patient safety. In terms of secondary outcomes like overall survival and response rates at week 12, there were no significant differences between the two groups. Both groups had similar safety profiles with common adverse events including anemia, neutropenia, and nausea. These findings suggest that while CAR-T therapy is safe, it does not offer a clear advantage over standard treatment in this patient population. The BELINDA trial provides valuable insights, but also underscores that tisagenlecleucel is not superior to the current standard care for patients with primary refractory or early relapsed aggressive B-cell lymphoma. Managing pre-infusion disease burden is critical, as a higher proportion of patients in the CAR-T group had progressive disease at infusion compared to the ASCT group. Tailoring therapy based on individual patient factors remains essential for optimizing outcomes. In summary, while CAR-T therapy like tisagenlecleucel shows promise, it's not more effective than standard salvage chemotherapy and ASCT for this patient population. Future research should focus on optimizing patient selection and combining treatments to achieve better outcomes. The BELINDA trial highlights the importance of continued innovation and personalized approaches in cancer treatment. For more details, check out the further reading in the description. If you found this video insightful, give it a thumbs up, share it with your colleagues, and subscribe for more updates on breakthrough cancer treatments. Thanks for watching. Stay tuned for more in-depth analyses and discussions on the latest in medical research.